everyone, and welcome. Today, we're going to tackle a topic that touches a lot of people's lives, spasticity. Our whole goal here is to really unpack what it is, where it comes from, and, most importantly, how it can be managed. We want to give you clear, straightforward information you can trust. So, let's get into it. And right off the bat, I want you to know where this info is coming from. Everything we're talking about today comes straight from the American Academy of Physical Medicine and Rehabilitation. So you can be sure you're getting information directly from the medical experts who live and breathe this stuff. So let's just jump right in with a question that really gets to the core of it all. What happens when your muscles just refuse to relax? For a lot of folks, that's not just a random question. It's a daily reality. And that experience is pretty much the definition of spasticity. Okay, so that leads us right into our first big topic. What is spasticity, really? To get a handle on how to manage it, we've got to first understand what's actually going on in the body. So, in the simplest terms, spasticity is a condition where your muscles feel super tight, stiff, and just plain hard to control. It's like this constant resistance, whether you're trying to move or even when you're just sitting still. And this is a really fantastic way to think about it. At its heart, spasticity is basically a communication breakdown. Your brain is trying to send a message to your muscles, but because of some nerve damage, that signal gets all scrambled. So instead of getting a clear, hey, relax now message, the muscles get a jumbled signal and just stay tense. And this stiffness, it isn't just in one place. It can pop up all over the body. The most common spots are in the arms, so think shoulders, elbows, wrists, and fingers. And in the legs, it often hits the hips, knees, ankles, and feet, which can obviously make walking a real challenge. All right, so why does that signal get scrambled in the first place? And what does spasticity actually feel like for someone going through it? Let's dive into the causes and symptoms next. Okay, so here's a key thing to remember. Spasticity usually doesn't just happen on its own. It's almost always caused by damage to the central nervous system. And that damage can come from a bunch of different conditions, like a stroke, a brain or spinal cord injury, multiple sclerosis, or cerebral palsy. You know, the way this shows up can be so different for everyone. For some, it's a constant nagging stiffness. For others, it's these sudden, uncontrollable muscle spasms that come out of nowhere. And all of that can lead to pain, make it tough to move or speak, and even create challenges with day-to-day things like getting dressed. Okay, I know hearing all that can feel a little heavy, but this is where we turn a corner, because this next part is all about hope and action. Let's talk about treatment options, because spasticity can be managed. And this is so important, because the goal isn't just about stopping the stiffness. It's so much bigger than that. It's about improving your ability to move, making you more comfortable, and heading off long-term problems down the road. It's all about improving your quality of life, period. A lot of times, the first line of defense, the real foundation, are these supportive therapies. You've got physical therapy, which is all about stretching and strengthening. Then there's occupational therapy to help you find new ways to do daily activities. Sometimes braces or casts are used to help position a limb. And of course, home exercises are absolutely crucial to keep the progress going. Then, of course, there are oral medications. Basically, these are pills you take that work throughout your whole body to help chill out those overactive nerve signals and bring down the overall muscle stiffness. A doctor might talk to you about meds like baclofen or tizanidine, and it's really important to have that conversation with your doctor because, as you can see, some are only meant for adults or older kids. But what if the issue is really just in one or two specific spots? Well, that's where injection treatments come in. Unlike a pill that affects your whole system, these injections go right into the specific muscles that are causing problems. For example, botulinum toxin can block the nerve signals to just one muscle group, helping it relax without affecting anything else. Now, for some really severe cases, there's a more advanced option. It's called intrathecal baclofen therapy. It's a two-step process. First, a small pump is surgically placed in the body. Then, that pump delivers medicine, a little at a time, right to the fluid around the spinal cord. It can be a real game changer for severe, widespread spasticity. So we've talked about therapies, medications, even surgery. That's a lot to handle, right? But the good news is you absolutely don't have to figure it out alone. That's why building the right care team is just essential. Let's look at who can help. Dealing with spasticity really does take a village. Your team might have a lot of familiar faces, like your main doctor, your therapist, maybe a neurologist. But you might notice one on this list that's a bit of a mouthful, the PM&R physician, or physiatrist. So you're probably wondering, what on earth is a physiatrist? Well, think of them as the team captain. These are medical doctors who are experts in how your nerves, muscles, and bones all work together. Because they see the big picture, they're often the ones who coordinate your entire care plan for spasticity.
All right, this brings us to what might be the most important part of this whole conversation. We've gone over a ton of information, and now it's about putting that knowledge into action by talking with your doctor.
Because you are the most important person on your care team. Seriously. Walking into your doctor's office, feeling prepared, knowing what to ask, it can change everything. It helps you become a true partner in your own healthcare. So, here are a few questions you can literally write down and take with you. Ask what treatments might be best for you specifically. How will they help? What are the side effects? Who else should you be talking to? And what's the long-term outlook? These questions open the door to building the right plan together. And let's end on this because it's the most important takeaway. It might feel overwhelming, but the message from the experts is filled with hope. With the right team and the right plan, spasticity can absolutely be managed. Thanks so much for joining me.